My name is Marc Beaghler, and along with my partner Mo Khoddami, I work at San Buenaventura Urology Clinic. Today we're going to talk to you about organic impotence and options that are available for you. First, what is erectile dysfunction? Erectile dysfunction is defined as the persistent inability to achieve or maintain an erection that is firm enough to have sexual intercourse. Erectile dysfunction is an extremely common problem. We see it often in men as they age. Approximately 1 in 5 Americans aged 20 or older suffer some degree of erectile dysfunction. In the United States, this may represent as many as 39 million men. What are the causes of erectile dysfunction? Common causes are diabetes, cardiovascular disease, treated prostate cancer, prior surgery, medications such as blood pressure medications and antidepressants, lifestyle choices such as excess smoking, alcohol, obesity, and lack of exercise, spinal cord injuries, and finally, hormonal problems can cause erectile dysfunction. Most causes are actually physiologic. 40% of causes are related to vascular, 30% are related to diabetes, 15% are related to medication, 5% are neurologic, 3% are endocrine, and 1% are unknown. There are a variety of treatments that are available, and today we'll discuss some of these so that you can help make an informed decision about what options you want to pursue. Often patients see us and we discuss medical therapy. Currently there are a number of medications that are available. The common names, of course, are Viagra, Levitra, and Cialis. And you may have been tried on one or even all of these medications prior to seeing us. Some patients do better on one medication than another, and also some patients have different side effects from one medication and not another medication. So oftentimes it's just a matter of finding the right appropriate medication for the patient. Some patients, however, don't respond to medications, so the question is, what are the other treatments that are available? The other treatments that are available are 1. A vacuum erection device, 2. Injections of medication or a pharmacologically induced erection, 3 is a medication that is placed as a urethral suppository. It's a medication called Muse, and that works well for many patients. Finally, another option for some patients, penile implant, which is a surgical solution to organic impotency. Let's go through each option individually. Let's start with a vacuum erection device. A vacuum erection device is a device that creates an erection by drawing blood into the penis. In men that are post-prostatectomy, often we'll recommend this as an initial form of therapy. In the first year after surgery, we'll ask them not to use a constriction band, and then after a year they can start using a constriction band. The constriction band functions by keeping blood in the penile bodies to allow the male to have sexual activity. We have a person that comes in, explains the use of the vacuum erection device and instructs the patient on the use of it. Also helps the patient in terms of purchasing the device and getting it covered by their insurance. So I may have you see that individual. Another option is a pharmacologically induced erection. In this treatment, we evaluate the patient by doing ultrasounds of their penis and their blood supply. We give them an injection of medication, and then we need to titrate the dose of medication to get the appropriate response. A pharmacologically induced erection can be a solution for a number of patients, but there are side effects, and one of them is what's called priapism. And to avoid this, we need to make sure that we do a titrated dose and find the optimal treatment with this medication. Even with that being done, priapism is a possibility. Another option for some patients is a penile implant. A penile implant is a surgical procedure in which we implant cylinders into the penile bodies, which are inside the penis. The patient has a reservoir where there's fluid and has a pump that they use to circulate the fluid between the reservoir and the cylinders. In some patients, this is the appropriate treatment, and many patients have good responses from this procedure. The problem is that it is surgery. There are risks associated, which include bleeding, infection, and the risk of anesthesia. Infection can be a complication in which we have to remove the penile implant. This occurs uncommonly. We use antibiotic-soaked implants and do everything possible to prevent infection. Even with this being done, there's still a reported 0.1% incidence of infection after a penile implant. But in the appropriate selected patient, this may be the best treatment option. In some patients, we'll also check their hormone levels. Hormone replacement therapy may be a part of your treatment for potency issues. Hormone replacement therapy means replacing the hormone testosterone. In general, in our practice, we use testosterone gels or creams. We will start you on that medication. We check a baseline testosterone, PSA, and hemoglobin level. And 4 to 6 weeks after starting treatment, we'll recheck your blood levels. If we have you at appropriate levels, then we'll follow you biannually with a complete blood count, a PSA, and a testosterone. It's important to understand that when getting hormone replacement therapy, it can cause an increase in the blood count. It can also cause an increase in your PSA, thus the rationale for biannual checking of your blood levels. In conclusion, we like to work with you to find the right solution to your impotency issue, and we will try to treat you based on what is the easiest and simplest solution to your problem. Regardless of what treatment you decide on, we can always try other options as time goes on. If you have further questions, please discuss them with me, and we'll work through trying to find an appropriate solution to your issue.